Welcome to COVID Q&A, your questions, our answers. As the HSC community comprised of staff, faculty, students, and community members begin their return to campus, it's important we continue to educate ourselves on COVID-19. Today, I'm sitting down with Dr. Kristina Kline, who is a clinical associate professor in the Department of Family Medicine at OU Tulsa. Dr. Kline will be answering a frequently asked question today. Dr. Kline, thanks for joining us. The question that we have for you today is, why are there various COVID-19 tests and what are the differences?
Darcy, that's a great question. There's currently 3 types of COVID testing that are available for people to get right now. The first and the most accurate is a molecular test, and it's also called a PCR test. It's considered the gold standard of testing. It's done by obtaining a nasal swab, and we usually get results back within 24 to 72 hours in most instances. There's also an antigen test, which is known as a rapid test, and this is usually done in a clinic setting or in an urgent care setting. It is not as accurate as the PCR test, and there's a high chance that if you get this test, that it may say that you don't have the disease and you might actually have the disease. If you would get a positive result, meaning that you have the disease, then it is considered very reliable. There's a third type of test out there that's considered an antibody test, and it's usually a blood test, and it tests for circulating antibodies that are in your blood. It may show that you've had COVID-19 in the past, but we don't really know what to do with that information. We know that antibody levels fall really fast after you've had COVID-19, and so it does not seem to be much immunity that goes along with that. So for that reason, the clinical purposes of antibody tests are not well known at this time.
Well, thank you so much for your time and your insight. We appreciate you.